All right. We should be live. And I can see the first comments. Awesome. So hang on just a second. There we go. So welcome everyone. I'm Roxana Sötebeer. Tonight we are doing part 2 of Are You Sleeping Well or Are You Just Sleeping? I'm joined again by Dr. Alan Schaffer, a board-certified sleep and obesity medicine specialist from the St. Peter's Sleep Center in Albany, New York. Dr. Schaffer has been practicing medicine for decades. He started his career in pulmonary and critical care, then went on to establish the first sleep center in Orange County, New York in 2003. Today, he focuses entirely on sleep and metabolic health, two fields that are deeply connected. Poor sleep drives insulin resistance and obesity, while excess weight makes sleep disorders worse. Dr. Schaffer calls this root cause medicine because improving sleep and metabolism improves health overall. Welcome, Dr. Schaffer.
Thank you, Roxanne. Great to be here again.
So we have a lot of questions, and Dr. Schaffer recommended a book. It's called Why We Sleep by Matthew Walker, and I read it and I learned a lot from it. So about at the halftime mark, we're going to go to the last page of the final chapter of his book, where he gives 12 tips for better sleep. But let's begin with some questions.
Before we do.
Oh, yeah. Oh, so good. So
okay.
I'm not a doctor. I can't treat, I can't diagnose, I can't even make a meal plan. Everything I say is for educational purpose, and the same goes for Dr. Schaffer.
Right.
I think you have prepared like a...
Yeah, just for the legalese of it, I'm going to read here. Nothing that is said here creates a doctor-patient relationship. The information presented in this event is for general educational purposes only and should not be considered medical advice. Always consult with a qualified healthcare professional for any health concerns. Okay?
Perfect. And that's that. We want people to learn how to get better sleep because it's so important. And we have viewers, like if you are watching, please type where you're watching from, and please share the video, because the more people learn about good sleep habits, the more people will get better. So Phyllis is there. I'm here in Missouri. It's cold here compared to the upper 90s. We have had for weeks. Okay, yeah, it's getting colder. Summer is probably just about done. Let's see here. Good evening from Iowa. Did I miss part 1? Yes, you missed part 1. And I actually listened to it today. And we could just put it out as a podcast because there was so much good information. Maybe let's start with the first question. Sleep is important. Why does it still get overlooked?
Well, in my world, it is not overlooked. I put quite the emphasis on it, both personally and professionally, of course. And thankfully, the medical community is seeing the value of sleep. Why is it overlooked? I think it's very much cultural. I remember when I was in my medical training doing pulmonary and critical care medicine, there was a bit of machismo involved in that and ego. And a lot of it was back in the day, we would spend the night in the hospital and we would brag that we, were up all night and we're still be able to practice good medicine. So there's, I think that that's mostly where it comes from. I think as time goes on, the state of knowledge about sleep is coming on from what I'm seeing. And I think people are getting the importance of good sleep. There are studies that show poor sleep, certainly impacts negatively your metabolic health, increasing your risk for insulin resistance and all that goes along with that, diabetes, et cetera, which is what your page is entirely about. Such an important topic. And the effects of sleep are so intertwined with that. So while it's always been overlooked, I think it's much less overlooked than it once was.
Yeah, I
Patients that
believe
come
that
to me,
too.
a lot of times patients come to me not needing to be educated about the importance of sleep, but they come to me because they're concerned that their sleep is impacting their health and want me to help with that. So I'm glad to
I
see that.
think I think one of the things, since you mentioned your training and people were proud and bragging about not sleeping so much, it's
Yeah.
almost like it's expected of residents not to sleep. And one chapter in that book actually talked about that this was introduced by a doctor not the Hopkins Hospital, I think.
Johns
And
Hopkins, okay.
yeah, and it turned out that he was on cocaine. So he didn't really need that much sleep.
Yeah. I mean, it is a double-edged sword, to just digress a little bit. And any anybody in my generation, before they limited the overnight hours, can tell you that by being there in the hospital overnight and during the day, 36-hour shifts as it were, is the time when you really learn the most. And like any other field, from what I see, experiential learning is far superior than reading a book and trying to memorize things. So there was benefit to that. However, there there are increases in medical errors from lack of sleep, and so that balance had to be adjusted for. And in fact, there are laws. I haven't paid attention to it much because I haven't been in the hospital world, but I think it was in the 80s or 90s, the Libby Zion case, I think it was in Massachusetts, where there was a bad outcome due to medical error from lack of sleep from probably a resident. And and since then, they passed laws limiting the amount of consecutive hours that physicians in training could do. So, and
Yeah, I
that's where
think
we're at
that's a
now.
good thing. But
Yeah.
being in the hospital, definitely like being immersed in that
Yeah.
environment would be good.
Yeah. Absolutely. Experiential learning. Hey, that's when I treated my own CPAP, I totally understood what it's like to be tired and then to get better and the issues that people might have with the CPAP. I'm very well in tune to that. When I lost my weight, I was very well in tune to what the struggles can be, but also how gratifying it can be to get to the weight that you want to be at and to
Yes.
pay forward, which is what I'm doing in my practice as much as I can.
Yep. Okay, so we have the first question. It's by Allegiance, I guess. I've been a biphasic sleeper for years. Could this be why I'm stalled after 2 years on carnivore? I've lost 60 pounds, but way more to go.
Okay, that's a bit of a loaded question. I'm assuming by biphasic sleep, you mean that you sleep for a certain period of time and then you're up for a few hours during the night, and then you have your second sleep session. I don't know if we can dialogue, but that's my understanding of a lot how people think of biphasic sleep. Um, I The issue of biphasic sleep is less important as long as there's adequate total sleep time. As I see it, um, as long as you're getting your adequate non-REM sleep time, your adequate sleep time, even if it's in two separate chunks, to my understanding, is less important than the consecutive sleep time. Now, of course, inadequate sleep time, inadequate any of the stages can certainly impact your metabolism, your ability to lose weight. I would say, thinking about circadian rhythms, the importance of when you're eating your meals. I would hope that in the middle of the night, as you're doing whatever activities you're talking about, that there's not eating involved, for one, because that would create a definite circadian misalignment, which we can talk about. It's important about when you eat, as well as what you eat. We all know about what you eat, of course. So the answer is it may be impacting it. When you phrase the question, could this be why? I would doubt it very much that it would be the only factor involved, but it might be contributing. So I would maybe talk to somebody about trying to get adequate sleep time, and there are various ways to do that. If your sleep time is inadequate, if your sleep time is adequate in 2 chunks, that might be okay. If you want to see what happens, again, we're all individual, we're all different. If you're able to consolidate your sleep more, maybe talk to a sleep specialist. There's a technique called sleep restriction, which may be of use in that. So I can't really give you, the perfect answer, not knowing all the circumstances.
I think Matthew Walker talked about biphasic sleep in his book too, but he had a different definition. For him, it was a nighttime sleep and then a siesta, like
and then a nap. Yes, that's correct.
In the early afternoon.
Right. If that's what the caller is talking about.
I don't think so.
I don't think so. Yeah. But he talked about how people who do sleep overnight and do have a siesta in the middle of the day, I think there's increase in longevity, which makes perfect sense. And I tell that to my patients all the time.
And who doesn't like to nap? That on the side. The other thing is, would it make sense for her to use a wearable to try to figure out if she does get enough sleep time?
It depends on how cognizant she is of her sleep. Many people are aware that many people can tell me, I can tell you how much sleep I get. I know when I go to sleep, I know when I wake up, et cetera, et cetera. If you're one of those people, you probably don't need a wearable to tell you what you already know. But if you're not certain, sometimes people are up in the middle of the night. If your biphasic sleep isn't that you do things on and off, maybe you stay in bed and you doze on and off, it may be a wearable, may be a useful tool in that case. Yeah.
And if you're all peachy throughout the day and awake and alert and not tired, that's another good indication that might work.
Absolutely. And those are the issues around that. So the concern was, is it stalling your weight loss? And the answer is maybe. But in terms of, yes, it's always a good marker to say, hey, I'm not getting that much sleep, or in this period of time, well, has this affected your daytime function? And the caveat against that, not against, but along with it, is to make sure you're considering any stimulant use, particularly caffeine, because that is most commonly what we use in most of our societies. So if you feel great during the day, and like my patient I saw today, who drinks 40 ounces of caffeinated cola a day, it's diet, so but still, yes. So that makes me wonder what this person might be without the caffeine. So I sort of always, in my mind, and I say it to the patient, index their daytime alertness functionality against their stimulant use.
Yep. Oh, right. So the next question is from a time traveler, relative to sleep. What are the best practices when flying across multiple time zones, like California to Southeast Asia? And I'm going to tag on my question. I'm going to go to Germany by the end of the month. That's like, how do you deal with jet lag? How do you train your body to adapt quickly?
Good question. That's a lot of time zones. So it's a matter of trying to entrain your circadian rhythm from your current situation to the time that it's going to, the time clock that it's going to be at your destination. And the ways there are basically formulas and sort of scales, and
Ooh, did my internet connection drop? Oopsie. History. I'm not sure. Did my internet connection drop or did Dr. Schaffer's drop? If anyone could comment. He froze. Oh, okay. I'm gonna send him a quick message, I guess. Hang on a second. So, from the book, though, I can. Oh, there's my phone. He dropped out, so I'm hoping he's gonna be back soon. You dropped out. Okay, but I'm gonna see when he's back. So, from what I've read in the book, Why We Sleep, there are certain tricks you can do to get adapted to a better time zone. So you can start teaching your body, get up a little earlier, like 20, 30 minutes every day. Trick your body with light. So turn off all lights earlier in the evening and turn blue light on earlier in the morning. You can also shift meal times, because it's not only light that dictates the circadian rhythm, it's also meal times that dictate the circadian rhythm. That's why it's important for nighttime workers too, night shift workers, not to eat during the night, because it tells the body that it is a different time. All right. Sorry about Dr. Schaffer dropping off. I don't know what's wrong with his internet. So we have Carolyn from Tracy, California. Temperature is 83. Last thing I want is a sleep-deprived dog. Yes, that is a problem, because I think after heart disease and cancer, medical errors are number 3. Let's see. Oh yeah, he says lost Wi-Fi. Okay. Mike, is this 7 p.m. Eastern or... I mean, yeah, we already started. Yes, so you said, yes, 10 p.m. awake at 2 up till 5, 6 a.m. That's a long time. We had that discussion actually in the PhD community. And I think it could also be a little bit of a habit, but I'm not sure about that. So when Dr. Schaffer comes back, I can ask him about that. I would probably try to do the most boring thing I could think of to get back to sleep, like reading the phone book. All right, there he is. There you are.
See, okay, got the video.
Yes.
Shoot, I can't hear you.
Oh, you can't hear me? I can hear. I can hear you.
Adapter here. I don't usually use.
I can hear you. Can you hear me now?
Okay.
Okay.
Can you say something?
Yep. Can you hear
No,
me?
I can't hear you still.
Oh,
Yes.
that's not good. I mean, technical difficulties. This is what happens when we go live.
Jackie?
Yes. Oh, no, that's not me. Mike says it says started streaming 8 minutes ago. Probably it should say started streaming 20 minutes ago by now. Yeah, no, that comment was a while ago. Then we have Susanna from Antioch. California. Not sure how that's pronounced. Hey, Mary. I'm going to see you next week. I've always read if you are awake in bed for 30 minutes, get up and do what? For how long before going back to bed? That is an excellent question. And actually, Matthew Walker talks about that. He says, if you're awake for longer than 30 minutes, get up and do something relaxing. So I'm guessing like reading a book, but it's got to be a book that's not too suspenseful, or anything that grabs you too much emotionally shouldn't be it. It could be listening to music. What I do when I cannot sleep at night, I listen to an audiobook. And the one audiobook, ironically,
Can you
I
hear
listen
me?
to the last. I can hear you.
You nodding. Okay, so you can. Okay.
Yeah. So ironically, the
All
book
right. I have two more
listened to
places I
was
can
Why
look
We
for
Sleep.
this. Ay.
Ay. I hope you got it sorted.
Jackie?
Okay, he froze. Yeah, froze. He did. Only his. Mine often freezes. Karate chop freeze.
Mm-hmm.
Okay. That is
what the
correct.
adapters for
Medical
the
errors
phone, for
are the number 3 cause of
the
death
audio
in
adapter?
America. And that's, I think, not the case in European countries where doctors are less sleep deprived
says not
or
available.
residents. Okay, so Mike says, I'm also 10 p.m. to 2 and awake till 5. Yeah, so it seems like Dr. Schaffer said the all over hours matter, and not so much that it's in one solid block. Personally, I would start wearing
It's this little white wire that connects to the phone and also.
an Aura Ring or an
the
Apple
headphone
Watch
jack.
or some Android watch that tracks the sleep. Technology is wonderful. Indeed, it is.
That's it.
When it works. There. Okay, while we're at it, hang tight with us because we are trying to get this going. If this doesn't work out at all, we're going to do a part 3 because technically we already started working, talking about some of the stuff.
Still cannot hear you.
Can you hear me now?
This is so frustrating.
Oh man, I'm guessing it's about allowing. Let's see. Maybe
Nope, still can't hear you.
permissions. Maybe permissions.
I think I got it. There we go. Now
You got
I can
me?
hear you.
Oh, awesome.
Yes, I can
so
see you and hear you.
I have
All right, I
already
just have to
answered
be on my phone.
all the question.
Okay, good.
Well, we
funny.
talked a little bit more about the biphasic sleep, and that you said as
Okay.
long as it's it's all over enough REM sleep, that should be good. So I said if it was me, I would try to track it. And I think you also mentioned before that if someone isn't really sleepy, it doesn't matter much, or if they're still functioning. There weren't much more questions. Let me go back here.
Okay.
Many more questions. This is. Oh yeah, we did talk about the time zones, and from my understanding,
That's right, the
it's
question
kind of
was-
training the body to go back with both tricking it with light and with food
So we're not going to
adjust the
do any
circadian
tricking.
rhythm.
Yeah. So what I do, so when I travel overseas, and it's harder to travel eastbound than it is westbound, is that I will gradually adjust the time that I go to bed and the time that I wake up in the morning, and try to mimic the ambient light to mimic the destination. Okay, so for instance, if I'm going from here to Germany, I'm in New York. Okay, was it 6 time zones? I think, depending on what time of year it is, maybe.
Yep,
But
it is 6, yeah.
what I'll do is I'll adjust my bedtime to. I always get confused. I always have to write this down. To a little bit earlier, by say maybe half an hour to an hour every night. I may take some melatonin beforehand as well. And what I do when I get on the plane is I'll take my. I generally do overnight flights when I travel overseas, across transatlantic, and I'll take my melatonin around 5 o'clock p.m. and I'll go to sleep. I won't eat because we don't want to eat too close to bedtime, even though it might be my physiological supper time, if you will. But I'll just skip that meal. I'll put my eye mask on and I'll go to sleep and hopefully wake up by the next morning, which would be 2 o'clock a.m. or 1 o'clock a.m. New York time, but it would be 7 a.m. in Munich, right?
Yeah, would be. So if you take
there are various ways to entrain your circadian rhythm to try to get it more to approximate your destination. And I think maybe do some reading, speak to a sleep specialist about it. And I'm glad to help anybody with that sort of thing, putting together ideas of what to do. But it's basically taking melatonin, light exposure modulation. In other words, there's sometimes you want to avoid light, sometimes you want to encourage light, and these can change your circadian rhythm either earlier or later, depending on the timing of it. So a circadian rhythm, as I suspect most people know here, but maybe not, there are many bodily functions that will vary throughout the 24-hour day. The main one we know about is the obvious one, which is our sleep-wake cycle. So we're going to be alert during the day, and we'll be not at all alert at night. And this is modulated by a hormone called melatonin. And the melatonin is pretty much zero or very low when we first wake up in the morning. It stays low until after lunch. There's a little bit of a temporary increase, the siesta time that we talked about. And then it stays low again until about 6 p.m. Then it starts gradually rising to peak around 11 o'clock. And as we go to sleep, it stays at that high level. And then at around 7, it plummets as we wake up. So what we want to do in in air travel across time zones, time travel would be fun too, is to try to either delay or advance that circadian rhythm. And so the techniques with light exposure modulation and taking exogenous melatonin, the timing of which is very important. So if you take melatonin at the wrong time, it can make things worse. If you increase your light exposure, it could make at the wrong time, it could make things worse, et cetera, et cetera. So
when melatonin peaks at 11 p.m. naturally, and I would go to, most people are in bed by 9 or 10 p.m. What would be an appropriate time if 10 p.m. was your I want to sleep time? Would it be like 2 hours or 20 minutes before sleep? Like, is there?
So if you want to, I don't use melatonin as a sleep aid, either personally or professionally.
Oh, no, just having it.
Okay, so
to make the sleepy
to get the
part.
maximal benefit, you would want to take it. And I have a lot of patients. I saw one today actually, a 19-year-old kid who can't get to sleep before 2:30 in the morning, and he has a hard time waking up for school. So I do about 5 or 6 hours before your physiological bedtime is the time to take melatonin, and then thereafter to limit your light exposure. So I told this 19-year-old kid, I said, take the melatonin around 9:30 and then just sit in the dark. That was a joke. And so we talked about things like sunglasses or blue light filter sunglasses, or decreasing screen time, dimming your lights. What else? Um, Going dark mode on your devices, blue light filter on devices. So those are some of the things that you can do. And I have patients keep a log of their sleep time, wake time, etc. So we can sort of get a visual about how they're doing.
Okay. 5 hours. That's is surprising. To take the melatonin supplement. And no, it's not like for me in general.
Let me sort of say that again. The idea isn't to take the melatonin so you can get to sleep earlier. It's to move your. It's to shift your circadian rhythm. And the dose doesn't particularly matter. So instead of taking a 5 or 10 milligram dose, if it's going to be for a 19-year-old kid at 9:30, he can, or somebody who has to do things, maybe a parent of young children or what have you, you can take as little as 300 micrograms, that being 0.3 milligrams. And the idea of that, it will still have the effect on shifting your circadian rhythm, but it won't have the same effect in making you drowsy, so maybe making it hard to function in the evening.
Okay, so it's more like training the circadian rhythm to get aligned again instead of an actual sleeping aid.
That's exactly right. Exactly right, yes.
Perfect. So Betsy asks, can you talk more about time restriction to improve sleep quality? I think you mentioned something like that last time.
It's called sleep restriction.
Yeah, well, you said someone asked about deep sleep, and you said like one thing you can do, but I don't recommend it, and you made that clear too, is a little sleep deprivation, because that tends to increase the depth of the sleep the next night. But Betsy actually asked about sleep quality, so I'm guessing restorative sleep. How? Yeah.
I don't know what time restriction. Does that mean sleep restriction? I'm guessing.
I think so.
So one of the things that sleep specialists do with patients with insomnia is called sleep restriction. So, and it's particularly helpful in people that are up a lot during the night. Say they sleep for an hour, up for half an hour, sleep for an hour, up for 2 hours, sleep for an hour, up 3 hours, whatever. What we'll do is.
Which one of us froze?
I'm back.
Yep. Okay. Perfect.
I got scared. A little PTSD. So I'll like total up the amount of sleep that they get, either with a wearable or from the patient's recall, and see if that's adequate sleep time. Sometimes it is, often it isn't. And so if the person is sleeping a total of 5 hours total, but they're in bed for 10 hours, I will have them limit the time in bed to say 6 hours, with the hope that that would help consolidate their sleep. Now that's often hard to do, especially if people are working jobs and have to be, in good shape the next day. So they would need to do the same bedtime every night, no matter how they feel. And they would have to get up and get out of bed the same time in the morning, no matter how they feel, and go with that. And then as time goes on, we sort of adjust the limits. So it's a technique, and it definitely requires working with somebody on that. So that will help some people improve their sleep quality by improving their sleep time, their total sleep time, and hopefully giving them more what's called consolidated sleep, so sleeping through. And this is different than biphasic sleep, so this is perfect 1-2 punch in questions. With the biphasic sleep, I'm assuming that the individual is sleeping a good chunk of time, so maybe had maybe 2 what we call non-REM cycles, which is good. By that I mean every hour and a half to 2 hours. It's normal that we go through different sleep stages. We cycle through. It starts in stage 2, which is your garden variety sleep. And then you go into deep sleep, which is stage 3. And then you go into REM sleep. And this cycle is about an hour and a half to 2 hours long. So in that case, if somebody gets 2 good cycles, great. And then they get 2 more cycles later, great. But for somebody who sleep is much more fragmented, like I was talking about, sleeping half an hour at a time or an hour at a time maybe, they're not getting their good non-REM cycle. So somebody like that, to consolidate their sleep more so they can get at least a few, so in 5 hours maybe 3 non-REM cycles, that would be a marked improvement. And that's how I interpret your question about improved sleep quality. Does that answer that?
I think so. And she also wrote yes about the time restriction, so we got that right.
The sleep restriction, great.
Mike says, last trip Athens to US, I was up 5 hours. I did doze a little on the plane, and at the airport I have a lot of trouble sleeping on an airplane. Yeah, it's cramped, of course.
I know, I'm 6'1" too. I get you.
I wanted to switch quickly to the 12 tips that Matthew Walker did in this book at the end of the book, Why We Sleep. So he says stick to a sleep schedule, going
Roxanne,
to bed and waking. Yep.
So maybe you could you read something and I can comment a little bit on it if I have anything.
Yeah, that was my idea. I'm going to
great.
bed and waking up at the same time every day. Why does that consistency matter so much?
Okay. So this goes back again to circadian rhythms, which seems to be the theme of the evening here.
Yes.
So for people that have trouble sleeping or want to have just good sleep health, consistency is important in that your melatonin is going to modulate when you're awake and when you're asleep, your natural melatonin. So if you go to sleep at 11 o'clock one night and you wake up at 7, fine. And then the next night you go to sleep at 1 o'clock and you're up until 9, your melatonin is not going to say, oh, it looks like you've decided to shift your circadian rhythm 2 hours. I will go along with it. No, that's not what's going to happen at all. So we get what's called circadian misalignment. So our internal circadian rhythm does not coincide with our external environmental situation, be it just maybe light exposure, maybe you're staying up and watching some TV, or maybe you have to do some work at night, or maybe you're out partying, whatever it is. But that misalignment can impact your metabolic health as well as your sleep health. So if your melatonin isn't at the right level, you're not going to get adequate sleep. In other words, so if you go from sleeping from 11 to 7 that first night, and then 1 o'clock you go to bed that next night, you may find that you naturally wake up at 7 o'clock. A lot of people I talk to, I say, what time do you wake up? And they tell me what time they wake up. And I say, do you use an alarm? And they say, yes, but a lot of times I wake up before the alarm. And some people just know, and they wake up like 5 minutes, because that's how strong the circadian rhythm is. So you're depriving yourself of sleep, which is not good in general, and also the circadian misalignment. So if I can get a little bit geeky here, your brain's circadian clock is again, it's centered in the suprachiasmatic nucleus of the brain, which is where melatonin acts, and melatonin is secreted in the pineal gland, which is right there, and all these things are right behind the eyes, so it's exposed, the light exposure directly affects it. So it's brilliant design, but that's the central nervous system, or the brain's circadian rhythm. But there are also peripheral circadian rhythms that many organs have. The liver, the the intestines. Now I'm losing. I wrote these all down too. Pancreas, which are three that are very important in digestive health. And so their natural circadian rhythms are not going to expect you to eat a meal at midnight before you go to sleep, because their circadian rhythms basically are going to be inactive. They're not going to secrete those pancreatic enzymes as well if you throw food at them at midnight. Okay.
Yeah.
The intestinal motility, the intestinal hormones, and the whole digestive process is not going to be happy, if you will.
I think
And
there's another
these-
good reason not to eat too late is that it raises the body temperature, and that will kind of like conflict with restorative sleep.
Yes, that's getting even geekier. I'm proud of you, Roxanne.
Well, I read it in the book, so I didn't come up with it.
So, but the important thing about misalignment and metabolic health, and that's where the circadian misalignment can actually increase your risk for insulin resistance. Again, coming
Yes.
back to metabolic health. So important sleep. And since we're on the subject, not only is it important to keep a regular sleep schedule, a sleep, go to sleep time and awake time, rise time, if you will. It's also important to have your meal times on a regular basis, because again, you want to align the brain's circadian rhythm with those peripheral organ circadian rhythms.
Would
And when
that
you
be a
do
good
that,
reason?
You're optimizing metabolic health. But
Would that be a
again,
good
if you
reason
eat-
to have breakfast better instead of supper if you eat 2 meals?
Well, see, there are pros and cons there also, right? Because we're talking about the time restricted eating or the intermittent fasting. When your window is going to be, but it's probably more beneficial, and they've looked at this, to do intermittent fasting earlier, but also having your larger meal not being your last meal of the day, maybe your midday meal as your larger meal may improve your metabolic health. And there are some
Yikes.
cultures which do that. Ours ain't one of them, right?
Yeah, that's true.
So,
Okay, so the second point he made was exercise. Exercise is great, but not too late. How does late exercise affect sleep quality, and what's the ideal timing?
so when you exercise, one of the good things is that you use ATP and you generate adenosine, which helps you sleep. However, you also are increasing your adrenaline, your norepinephrine level, and that can rev you up a little bit too much for people. So for people that have difficulty sleeping, or people that want optimal sleep health, the recommendation is not to do vigorous exercise within 4 hours before bedtime.
All right, so I'm going to combine points 3 and 4 because we need to get through them. Avoid caffeine and nicotine; they are stimulants, and avoid alcohol before bed because I think it fragments the sleep and also messes with REM sleep. He talked in the book about alcohol then wearing off through the night,
So let
like
me
the
talk about
sleepy effect of alcohol, and then you wake up and can't go back to sleep. Is that true?
Right. That's exactly true. So since we're talking about alcohol is a central nervous system depressant, and it may aid somebody in falling asleep. However, when it gets out of your system, you get what's called rebound insomnia often. So if you wake up, it'll be that much harder to get to sleep. And it'll be even more difficult to get to sleep after waking up having had some alcohol than if you hadn't had alcohol and you just woke up for whatever reason. In other words, the level of insomnia is going to be augmented by the wearing off of the alcohol. Rebound insomnia. So not just returning to baseline, but rebounding and becoming even worse. And that's why it's not recommended to use alcohol to aid with sleep, not to mention the other potential health hazards of it. And what was the other one? Nicotine and caffeine, right?
Yeah, nicotine and caffeine because they are stimulants. I mean, that makes sense. I think in the book he said about 8, it can take 8 hours to wear off. Like
sometimes as much as 14 hours, depending on the individual. So different people will metabolize caffeine at different rates, just like any other medication, just like any other food, just like any other thing that you ingest. So it's variable. There are some people. I was talking to somebody, a patient today. We talked about caffeine, as I always do, and she said that yeah, it doesn't ever affect me. In fact, sometimes I even have a cup of coffee, which will help me get to sleep at night. I'm like, okay.
Kind of
just never
because
know.
it's a warm beverage, maybe. But do you think it might have an effect that she doesn't even know it has?
Anything is possible. But when somebody tells me they do something and it helps them sleep,
It's good.
hey docs, hey doc, it hurts when I do this. Do this. Okay,
Yes,
don't
don't
do
do
it.
it.
Hey doc, it helps when I do this. Do it.
Yes, yes, exactly.
Unless it's going to be obviously harmful.
All right, we already talked about not having large meals before bed, and the same is true for fluids. You don't want to drink too much. Point six is watch medications that disrupt sleep. Some common meds interfere with sleep, like I think some. So this is not about you not taking these meds. This is about talking to your doctor. How can we better arrange or better take meds? Like it's blood pressure medication, heart medication. They can have a disruptive effect?
Yeah, absolutely. Yeah, there are many medications that can disrupt sleep. The beta blockers, for one, propranolol is very commonly understood, and they can cause insomnia. Propranolol also can, uh, and maybe other beta blockers, not quite clear, can block the conversion of thyroid hormone T4 to T3, so induce a less active thyroid function, which can cause different problems. But yes, and there are so many medications that can impact sleep negatively. Some antidepressants can aid sleep. Sometimes some can negatively impact it. And of course, as we know, many antidepressants and certainly antipsychotic medications can cause weight gain via insulin resistance. That's very clear. But
And yeah, so there were a lot of don'ts. Don't do this. Don't do this. But there's also a lot of do's that Doctor. No, I think he is a doctor.
he's a PhD.
He's a PhD, so he's a doctor.
He's
Yes.
a neuroscientist researcher. He's a PhD. Yes, he's
Yeah, he teach.
not a medical
I think he
doctor. He doesn't
teaches,
treat
or he did
patients.
teach too. So there is some do's that you can do to help sleep, and I'm going to summarize some. 8 is relax before bed. 9 is a hot bath before bed. 10 is dark, cool, gadget-free bedrooms, and sun exposure in the morning. Okay, those are 5. We talked about light exposure. We talked about the gadgets and the turning down of light. We did not talk so much about the core temperature. He said a hot bath before bed, when you get out of the bathtub, it lowers the core temperature, and that helps you fall asleep.
Yeah. So the heat from the water will help vasodilate you, right? Which means your blood vessels on the surface of your skin will dilate, and that will help you eliminate the heat, lowering your pressure, that. It's been shown that a nice hot bath 2 hours before bedtime significantly improves stage 3 sleep or deep sleep, for sure.
It's also great me time. So people really should take good care of themselves. And the 12th point was don't lie awake in bed. And that was actually a question that was asked earlier, where we had problems with the connection. In the book, he says, don't lie in bed for more than 30 minutes. If you can't go to sleep, get up and do something relaxing.
Right. So yes, this is called stimulus control, is the technique, and people who treat insomnia use this very commonly, even more commonly than the sleep restriction. So it's usually my go-to first recommendation, because a lot of people will say, I'll say, well, it's always, what time do you go to bed? They tell me. How long does it take you to sleep? They'll tell me. And sometimes it'll be a long time. Once you fall asleep, do you sleep through or do you wake up? I wake up. How many times they tell me. How long are you up for? What do you do when you wake up in the middle of the night? So many times people say, I stay in bed and I try to sleep. So the word try, okay, means it's
like
an
really
active
hard.
process. Yes. Okay. But the thing is, sleep is not an active process. It is a passive process. Your brain will sleep. Sometimes it may be delayed if there are various factors that are obstacles to your sleep. And many of those we can create ourselves, okay, by the stimulants, et cetera, and all those things. But also, if we just stay in bed, many people, their mind will race and they'll go over all the things that happen during the day and things that bother them, worries, concerns, and this tends to worsen the problem, number one. So as an aside, I often tell people just to, in the evening, just if that happens with you, just list all the things that's going on in your life and your mind and process them. And I might have said this the first hour when we did this before, and just sort of designate worry time, write it down, decide what you're going to do about each problem. So say you were at work and somebody said something that you didn't like and you didn't know what they meant. So you decide, you know what, I'm going to talk to that person tomorrow. That way, when you're lying in bed and all these things start coming, oh, that person said something, you start getting really angry. Oh, wait, I'm not sure what they meant. And I've already decided what I'm going to do. So then you can maybe put that idea to bed, unintended. Okay?
And even if you play the conversation in your head, that might put you to sleep too.
It might. But the idea is just not to accelerate and the angst.
Yes.
So that's a worry time. But also, if you're in bed for more than 20 minutes, he says half hour, I say 20 minutes, it's likely that it's going to take even longer. So I tell patients to get out of bed after 20 minutes or so, if you're not asleep. And not only get out of bed, but leave the bedroom. And do something quiet, maybe a little music, a little reading, a little TV, nothing too stimulating. And only go back to bed when you're sleeping. Okay? Do not let yourself fall asleep outside the bedroom because that defeats the purpose. And if when you go back to your sleep, you go back to bed and another 20 minutes goes by, rinse and repeat. Okay? The idea is to dissociate being not only in your bed, but in your bedroom with and being awake. Because the bed is supposed to be for three things, the three S's: sleep, sickness, and sex. Okay? Other than that, you don't need to be in your bedroom. I'll often ask patients, do you spend any time during the day in your bedroom? Some people have their home office in their bedroom. Again, that's an association we want to break. So when they say yes, I explain what I just did to you, and I'll recommend, is there somewhere else in your home that you can do this work? So
that makes sense. I think most importantly, don't pick up something where you are going to be really engaged and then don't want to stop, because that's usually me.
Right. That's why it says nothing too stimulating. Maybe a little chill music, or classical music, not heavy metal.
Yeah. We have another question. Do we know that poor sleep plays into cognitive decline, dementia as we age? I think the evidence there is pretty strong.
Yeah, it is very strong. Decreased life expectancy and definitely cognitive impairment, increased risk for dementia, for sure. I can't go into the details on that, but sleep is important.
Yeah, and no sleep leads to very early demise. Jan has a question. Sleeping well 8 hours a night. I'm on oxygen from lung failure and lung cancer. Some days I'm very tired and need to lay down and take a nap for a few hours. I get up and go on with my day. Oh, that was one of two. There's the rest of the question. Is it okay and will it help my healing? Basically, is it okay if she sleeps a long time and then adds a long nap? I'd say yes.
Yes. I mean, I can't say what your circumstance is, because being on oxygen from lung failure, having lung cancer. Are there any other reasons you're on oxygen? A lot of people have emphysema or COPD and are on oxygen for that reason. And when you do have any kind of cancer, you tend to want to sleep more. So I would just listen to your body in that. And again, it's not medical advice; it's just based on what I would know. But
Exactly, listen to the body. Dr. Walker also made a comment about sleeping too much, and he said it's probably not sleeping too much, but it's the body needing much more sleep to heal. And when the body then can't cope, that's not because people slept too much, but because it still wasn't enough.
Yeah, there are sleep disorders too. Again, sleep apnea is the classic one, and it's not always clear. So people who sleep 8 hours a night, wake up feeling tired or sleepy during the day, that's one of the considerations. Or there are several other sleep disorders. So
and you see, I'm a geek. There he said
so
it.
it's good to it's good to consider promoting healthy sleep, but part of that also is consider sleep disorders that you might not be aware are occurring.
Yeah, I would definitely say if someone has trouble sleeping and can't figure it out themselves, see a sleep specialist, see a doctor, and get to the root of the problem. If it's not nutrition, it might be something else. Valerie says, according to my genetic testing, I metabolize caffeine quickly. When younger, I did drink caffeine right before bed and no effects. Well, lucky.
That's right.
Oh, what about decaf? You can drink decaf at night, or will it still stimulate your brain?
It depends on you.
Okay.
Again, if it ain't broke, don't fix it. If it works, do it. If it don't work, don't do it.
Yeah, that's true. Okay, Phyllis says, a month ago I rolled out of bed in a deep sleep and my low back has hurt a level 10 for a month. I'm in the ER right now. Ooh, okay, just got x-rayed. I kept saying maybe it will go away. It hasn't. Okay, good luck, Phyllis.
Yeah, feel better.
We talked
Hope
about
you didn't
that
do anything
in the Dr. Berry community too. Let's see if there is another question.
Rolling out of bed could be a sign of a sleep disorder too. So if there's no clear explanation, and maybe it's happened more than once, it might be worth a visit to a sleep center as well. Darlene.
I think it was like a once in a long time thing. Yep. Darlene has a question. My phone has a night mode that makes the screen dimmer with less blue light, but it still affects falling asleep.
I mean, it would be. It certainly can if that's an issue for you. If you have an issue falling asleep, then yes. If you don't have an issue falling asleep, I wouldn't worry too much about it. But certainly dimming it is better than having it on, higher brightness or more blue light, for sure. And
what do you think about?
The other thing is the other sleep hygiene issue is in terms of not being on your phone in bed, because that's a big one. It's so addicting, and so many of us do that, myself included. And it's I always advise people just put your phone down or away. It's good if it's not within reach. So
people have to get real with themselves. They have to know, is this a problem or not? And I'm going to say, yes, it's a problem, because once you start one reel or one TikTok, another 3 hours later, where did the time go? It is really best practice not to have phones in the bed. And
for sure.
You just got to make that commitment. Consistency is key. Sandra says, I forgot the QQQ before my question. Oh, I wished you had... Oh, there. For circadian rhythm, does it matter how early and how long you get morning light? My drive 30 minutes to work, 1 hour after sunrise. Is that sufficient?
So I can't say one way or the other, but it ought to be. When we look at things like treating seasonal affective disorder or in training the circadian rhythm, 20 minutes usually of relatively high intensity light. There are light boxes that you can use. I would think 30 minutes should be terrific. And if you work indoors all day, try to get outside, that sort of thing.
I just bought like 3 light bulbs that you can program to be a certain temperature of light, like 5600 K. Putting them on full blast first thing in the morning, does that help, or does it have to be sunlight?
It'll probably help. It'll probably help.
Okay, because I'm not an outdoorsy person, I guess.
Yeah, it's, you're up north too, so it's sunlight is the best. Purchasing a light box, 10,000 lux is what we typically use. So more intense light is good.
Okay, that sounds very bright. We are coming up to the hour, and I can't believe how fast the time passed.
We had fun, didn't we?
Yes, absolutely. Dr. Schaffer, I want to thank you for your insights tonight. And I would like everyone to share this video, even though there was a little in the middle where we had technical difficulties. Subscribe to the channel. I'm having weekly Zoom meetings on Patreon. If you want to join that Patreon community, I'm just going to put the link on here really quick. There. And oops, I just lost my notes. So I'm going to say prioritize your sleep. It's not optional. And maybe you can apply some of the tips we talked about today. Dr. Schaffer, do you have like parting words?
Oh, I wasn't ready for that.
Yeah. Well,
No,
I mean,
just,
we can go on and talk for another half hour, but
yeah, for sure. First of all, I appreciate the time, and my goal is just to help people understand sleep better, realize that sleep is such an important part of metabolic health specifically, and overall health in general. And those really are two of the same things. I mean, when you have your metabolic health, you have your health pretty much. And the interaction between sleep and metabolism and insulin resistance and metabolic health, and it's also very, very interconnected. You can't do one without the other.
I urge everyone to get this book, Why We Sleep by Matthew Walker. I'm going to put a link in the description, or there might already be a link. And we might have to do a part 3.
Hey, we'll manage.
Yes.
My pleasure.
Alrighty. Thank you everyone for tuning in. Please share this, and I'm going to say goodbye.